Hello everyone. Today's video is on Medicare Basics, specifically for residents of Massachusetts who are turning 65 years old. Hi, my name is Mike McHugh and I'm an independent Medicare advisor to residents all over Massachusetts. And I made this video today because Massachusetts has a different Medicare benefit structure than other states, which generally speaking tends to prompt different questions. So I hope that this video today provides the broad strokes of any questions or concerns you may have. And as an independent broker, I try to primarily work with people turning 65 all over Massachusetts, and the reasons for that are simple enough. You can make less mistakes if you learn about Medicare and you get a real Medicare education during your IEP and you're approaching your 65th birthday. So that's really where we'll start, and I'll cover some of the questions and issues that I tend to see come up repetitiously. The first part we're going to go over is your IEP, your initial election period. The decisions that I believe you should consider, and this would be the basics that I am coming up with. These are not the basics that are in a Medicare catalog or in a Medicare book by any means. We'll go over a free checklist guide that I've been giving away for a while, and it seemed to really help a lot of people during COVID just because of the lack of human resources. We'll go over some of the top mistakes that I've seen made, and then finally we'll go over information that you may or may not want to consider credible as you go through your Medicare journey seeking information. So starting off right at the top, as you approach your 65th birthday, you're going to interact with something known as an initial election period, or IEP. And an IEP is simply a 7-month period. It's the month you turn 65, and then it's the 3 months on both sides of it, both beginning and ending. If you turn 65 on the first of a month, that simply means that your IEP will start 1 month earlier. So really, it's just a 7-month period, and during that time, you need to make certain election choices in order to be considered credible by Medicare, whether you go on to full Medicare A and B, also known as original Medicare, or whether you take just Part A and continue on your private insurance. And during that IEP, as I said, the first decision you need to make is whether you're going to enroll in Part A only or Parts A and B. That can be an arduous process for some, depending on your situation, whether there are other people on your plan, or whether you're just trying to crunch numbers, because typically the plan benefits you will run into in Medicare are much different than what you've been getting as a private plan. So you really want to sit down and put pen to paper as to what makes the most dollars and cents as far as your healthcare choices moving forward. And this can be complicated. This can be complicated for a number of reasons. It's one of the services we offer as an independent analysis, so to speak. We will go through your real hard costs because a lot of people haven't really considered what they're paying for insurance or what they could be paying for insurance simply because they haven't had that many choices. So the first thing you need to figure out is whether it's A or A and B and other plan elections. And then from there, usually the next situation or phase in the decision-making process will show itself, depending on which choice you really go through. It's important for you to understand that prior to making these choices, what original Medicare will and will not provide you with. Because right then and there, you'll probably have a good baseline idea as to whether you have something that is favorable or not favorable compared to what you could have with Medicare. And as I mentioned earlier, I did author a brief checklist guide for Mass residents going into their IEP. And the reason being is COVID made the human resources that would typically be available, people like me, even volunteers that are typically available, not available. So that added extra anxiety to the topic of Medicare for some. And this checklist guide is really just meant to kind of guide your thinking, so to speak. It's not the end-all guide. It's not going to give you one determination or another. But what it can do is kind of coach you and coach your thinking as to what information you want to collect from your current situation and then from your potential would-be Medicare situation, so you can start boiling down information and making real decisions. So the guide is intended to do just that. It's not endorsed by Medicare or any official bodies. It's simply something that I've developed, but I have tested it, and a few people, more than a few people, have come back to me and thanked me, saying it really did help them with their decisions, and they're going to be saving a good amount of money with the choices they made. So I hope that if that is something that you think you would benefit from, you download it. It's right at the bottom of this screen. And we're also going to go over the top mistakes. I'm just going to list them briefly and give you a quick description just so you're aware and hopefully you can avoid them. The first mistake is probably the most common that I've seen, and that's conflating original Medicare and Medicare Advantage, otherwise known as Part C. Medicare Advantage takes the place of original Medicare as a single payer for billing. And that's in most cases. But really, what it is not something you can add on to original Medicare like a supplement plan. It's something that replaces original Medicare A and B, and it replaces it with its own private plan and structure, and oftentimes benefits that typically are not available under original Medicare, which is why they're attractive to many people. The second mistake would be overpaying or simply assuming that the most expensive plan is the best plan or provides the most coverage. I've seen people pay a lot for a long time before meeting me and having me explain to them how this really works, and them kind of go through the discovery process of realizing they could have saved a lot of money over the years, but that's okay. Better now than never. The other one would be ignoring IEP and timelines. This will lead to penalties, as you can see 2 bullet points below. Ignoring IEP will not make it go away. It will turn a great opportunity into a great problem. Do not do this. This is not one of those situations in life where ignorance is bliss. So don't ignore it. You can call anytime to set up an appointment and I'll help you through it personally. So consider that if you really are overwhelmed. Another issue that I do tend to see is thinking that Medicare covers everything. And I see this typically with people that don't take any prescriptions or use a lot of Medicare services, or I should say medical services. And the reason being is they thought that when they applied for original Medicare A and B, that most everything would be covered on there and they wouldn't be incurring any fees. If you make this mistake, you are in for a rude awakening, especially if you are admitted to a hospital. So it does not, and there are other elections that need to be made. So please be advised, if you don't know what those are, there are other videos on this topic, and I will be making more videos on each one of these. But do not ignore your IEP and do not assume that Medicare will cover everything, because it does not. Another one would be not researching drug plans and provider networks. This is something that you see all the time. It could almost wrap in with people paying too much for unnecessary services. As we sit right now in 2021, there are 25 different drug plans available in Massachusetts, and there are even more Medicare Advantage plans with the Part D component included in the plan available to Mass residents. So these are things you probably want to consider before enrolling in a plan, and not doing that can add a lot of dollars and cents to your medical expenditures by the end of the year. And finally, the biggest issue that I see is that Medicare beneficiaries, for a lot of reasons, or at least for a few reasons, are apprehensive on getting a professional opinion. That doesn't mean you have to talk to me. I'm making this video series not because I'm a professional videographer, but because I realize some Medicare topics do require human context and human conversation. And in COVID, it wouldn't be responsible of me to start seeing people again, despite the fact that I'm 34 and lucky to be in good health. Right now, I'm just not taking face-to-face meetings. And I know how much that anxiety can build when you have questions about Medicare and you're not sure who to ask or what to ask, or even if it's a good question. So what I really want to reinforce here is don't be afraid to ask. Don't be afraid to ask for multiple opinions. You can call Social Security, you can call me, you can call a lot of other resources, but make sure you get a real professional opinion. And I guess you can define professional as in experience. You want someone that has a lot of experience working with Medicare. I would advise against asking your neighbor Susie unless Susie knows a real lot about Medicare and Medicare plan selection. So get a professional opinion. It's not going to cost you anything. I have not run into anyone yet that charges fees or anything unnecessary to help someone with their situation. So with that being said, I'd love to hear from you. Again, my name is Mike McHugh and I own MedicareMike.org. To set up an appointment, you can call direct. Our direct line here is 617-932-1200. You can email me. My email is mike@medicaremike.org, or you can use the calendar link below this video to set up an appointment at your time. So I hope to hear from you, and I hope you're well, and I hope that this was helpful. Take care.